over 60, turmeric is often praised as one of the safest, most powerful natural anti-inflammatories, and many seniors take it daily for joints, pain, and overall health. But what most people don't realize is that turmeric can become dangerous when combined with certain common medications. These interactions don't always cause immediate symptoms. Instead, they quietly increase the risk of bleeding, blood pressure problems, or organ stress, especially in aging bodies that process supplements differently than they used to. In fact, when taken alongside some very common prescriptions, turmeric can quietly increase the risk of serious side effects. What makes this especially concerning is that the medications involved are some of the most commonly prescribed after 60, and many seniors take turmeric, believing it can only help, never harm. Today, I'm going to explain 3 medications that should never be taken with turmeric, why these combinations are risky for seniors, and what safer alternatives or precautions you should consider before using turmeric regularly. If you take turmeric or are thinking about taking it, this is information you need before continuing. The first and most important interaction is blood-thinning medications. This includes prescriptions like warfarin, clopidogrel, and even daily low-dose aspirin. Turmeric naturally thins the blood by reducing clotting activity. On its own, this effect is usually mild, but when combined with blood thinners, it can significantly increase the risk of excessive bleeding. For seniors, this can show up as frequent bruising, nosebleeds, bleeding gums, or prolonged bleeding from small cuts. In more serious cases, it can increase the risk of internal bleeding, which may not be noticed until it becomes dangerous. Aging blood vessels are more fragile, and the combination of turmeric and blood thinners places extra strain on the body's ability to control bleeding. If you are taking any form of blood-thinning medication, turmeric should never be added without medical supervision. The second risky combination involves blood pressure medications. Many seniors take medication to lower blood pressure, including ACE inhibitors, beta blockers, and calcium channel blockers. Turmeric can also lower blood pressure naturally by relaxing blood vessels and improving circulation. While that may sound beneficial, combining turmeric with blood pressure medication can cause blood pressure to drop too low. This may lead to dizziness, lightheadedness, weakness, blurred vision, or fainting, especially when standing up. For seniors, this dramatically increases the risk of falls, which can have serious consequences. Low blood pressure episodes often happen quietly, especially in the morning or after meals, and are sometimes blamed on age rather than medication interactions. This makes the turmeric blood pressure combination particularly dangerous. The third medication group to be cautious with is diabetes medications. Turmeric can lower blood sugar levels, which is one reason it's popular among people managing blood sugar. However, when taken alongside insulin or oral diabetes medications, turmeric can cause blood sugar to drop too low. Low blood sugar can lead to shakiness, confusion, sweating, fatigue, headaches, and in severe cases, loss of consciousness. Seniors may not always feel early warning signs, making hypoglycemia especially risky. Over time, repeated low blood sugar episodes can affect brain health and overall stability. Now, this does not mean turmeric is bad or that no senior should ever take it. The key issue is combination and dosage. Many of the risks come from high-dose turmeric supplements, especially those combined with black pepper extract, which dramatically increases absorption. These concentrated forms act much more like a medication than a spice used in cooking. Using turmeric occasionally in food is generally safer than taking high-dose capsules every day. Even then, seniors taking medications should always discuss supplement use with their healthcare provider. Another important factor is liver and kidney health. Turmeric is processed by the liver and kidneys, and aging organs may not handle large supplemental doses efficiently. This can lead to added stress over time. especially when medications are already being processed through the same systems. The safest approach after 60 is not to assume that natural means harmless. Supplements can be powerful, and power requires caution. If you are considering turmeric for joint pain or inflammation, there may be safer alternatives depending on your medications. Lower doses, food-based use, or other anti-inflammatory options may provide benefits without unnecessary risk. The most important takeaway is this: never combine turmeric supplements with prescription medications without guidance, especially blood thinners, blood pressure drugs, or diabetes medications. Protecting your health after 60 is not about avoiding natural remedies. It's about using them wisely, at the right time, and in the right way for your body now. If this information helped you, take a moment to like the video, share it with someone you care about, and subscribe for more senior-focused health guidance. One simple conversation with your doctor can prevent serious complications. Your health deserves informed choices.